Texas Senate Bill 378 of the 89th Regular Legislative Session, also known as the Botox Party Bill, is legislation that adds a new section to the Texas Occupations Code outlining several key provisions. The bill explicitly prohibits barbers and cosmetologists, as well as estheticians, from performing medical procedures such as injections and dermal incisions unless they hold the appropriate medical license. The bill was introduced to enhance consumer safety and clarify regulatory oversight between the Texas Department of Licensing and Regulation and the Texas Medical Board. This bill is sponsored by Texas Senator Charles Schwertner. Schwertner is an experienced politician. Before holding office in Senate, he also served as a Texas House Representative. It's important to note that in addition to his career as a Texas politician, he also currently holds a license as a physician, specializing in orthopedic medicine. Because of his dual background in medicine and business, Schwertner often engages in legislation related to healthcare and business regulation. His medical background has informed his work on health and human services policy, including medical-related regulatory issues. Texas history of pro-business and lax legislation when it comes to business regulation, the Texas med spa business community has expanded quickly but dangerously due to the lack of regulation and oversight. We have non-medical professionals out there doing injectables and doing medical-grade procedures. These individuals are not medically prepared, and they're also not working under a medical director. Unfortunately, there hasn't been any strict regulations in regards to aesthetic procedures until now, I hope. Under Senate Bill 378, barbers and cosmetologists are prohibited from performing injectables or any procedures that penetrate the skin. This would include services such as dermal fillers, which are actually considered implants, microneedling, lasers, and chemical peels. We cannot forget injectable neurotoxins such as Botox. People tend to forget Botox is a medication just like any medication. When you go to the hospital or see your primary care provider, would you have a non-medical licensed personnel injecting you? Of course not. So we need to continue that practice in aesthetics and ensure that medical level procedures are only performed by licensed medical providers such as your physicians, nurse practitioners, physician's assistants, and specially trained nurses who have the appropriate oversight to perform these procedures safely and legally. This bill clarifies a scope of practice for beauty industry professionals and helps, most importantly, protect the public safety by preventing unlicensed and unqualified individuals from performing cosmetic medical procedures. These supporting points for public safety and consumer protection come from analysis of the bill text and regulatory policy reviews. From a business standpoint, these are measures of consumer protection and not an expansion of regulation. Clarifying legal boundaries and accountability. The language of the bill focuses on the structural and legal purpose, which is tightening definitions so the law matches current cosmetic industry practices. While supporters view SB 378 as a consumer safety measure, critics argue that the bill introduces new restrictions without meaningfully changing how cosmetic procedures are currently regulated in Texas. Cosmetic injection academies were quick to respond to actions by the Texas legislature as the bill moved along swiftly in the House and Senate. Advertisements for cosmetic injection programs showed the certification courses were picking up in frequency, heading into the uncertainty of what effect the bill would have on their industry if passed. SB 378 likely will not significantly improve public safety, but rather it could actually create unnecessary limits for cosmetology professionals. Texas medical practice laws already allow physicians to delegate certain cosmetic injections to trained non-physician professionals under medical supervision, which means many of the procedures targeted by the bill are already legally performed outside the cosmetology license structure. Furthermore, SB 378 could reduce income opportunities for small cosmetology businesses, restrict access to affordable cosmetic services for customers, and place additional regulatory burdens on the industry. Limiting the number of individuals able to perform these procedures will result in longer wait times and significantly higher procedure costs. The bill could create a massive economic crisis for the Texas cosmetic industry with a pointed focus on med spas. Many of these clinics and professionals have invested extensive amounts of time and money into their businesses. Restricting these practices will inevitably harm small businesses as well as the state's economy. These state-approved certification programs adequately prepare cosmetic professionals to provide these services safely. There is not sufficient data to claim that these services, when provided by a non-medical licensed individual, results in higher complications. The progression of the bill here, as it started out being read to the Senate on the third day of the 89th regular sessions. Senate action in SB 378 by Schwertner relating to certain prohibited practices by a barber or cosmetologist. This bill was referred to the Committee on Business and Commerce. Once in the House on the 47th day of the 89th regular sessions, SB 378 was referred to licensing and administrative procedures. The bill was passed in the Texas Senate with 30 yeas and 0 nays. The bill was passed in the Texas House with 107 yeas and 39 nays. While the bill passed both the Texas Senate and House, Texas Senate Bill 378 did not become a law since Governor Abbott vetoed it on the last day of the 2025 legislative session. On the final day of the 89th Texas Legislature regular session, Governor Greg Abbott stated the following in regards to Senate Bill 378. Pursuant to Article 4, Section 14 of the Texas Constitution, I, Greg Abbott, Governor of Texas, do hereby disapprove and veto Senate Bill number 378 on the 89th Texas Legislature regular sessions due to the following objections. Texas should be removing barriers for small businesses and occupational licensees. Senate Bill 378 by Schwertner does just the opposite by, among other things, prohibiting a licensed cosmetologist or barber from making an incision into the dermis layer of a person's skin. Barbers who nick a customer's neck during a straight razor shave should not fear the loss of their licenses. As we work to make government more efficient and less intrusive for Texans and businesses, unnecessary and overly burdensome regulations are counterproductive. Therefore, I disapprove this bill. Since you remain gathered in regular sessions and continue to conduct formal businesses, I am delivering this disapproval message directly to you along with the unsigned official enrolled copy of the bill. Respectfully submitted, Governor Greg Abbott.